Hi, my name is Folakemi and I'm a doctor. I also do dance and I'm a TV presenter. And today I'm going to be talking about hypertension. Hypertension is very common in this part of the world, and where I work in the hospital, we see several cases of complications of hypertension. People presenting with stroke, people presenting with heart failure, kidney failure, heart attacks, myocardial infarction, and they're really scary. And it's really sad because most of these very serious conditions could have been prevented if people knew their blood pressure, knew they were hypertensive, and took medications and made lifestyle changes to control hypertension. So what is hypertension or high blood pressure? Hypertension is when the blood pressure in the arteries is higher than normal. The normal value usually is from 100/60 to 130/80. We have what we call a maximum or a systolic and minimum or diastolic blood pressure, which we can measure using a blood pressure monitor. And when it's above 130/80, or if it's 140/90 and above, we say that is high blood pressure. And there are two types of high blood pressure. There's the primary and the secondary. Now the secondary is not as common. It's just about 10% of cases of hypertension worldwide is secondary hypertension, and that is hypertension that has a known cause. So in that case of hypertension, once you can treat the known cause, the underlying cause, it can be curable and the person doesn't need to be on medications for life. But the primary hypertension or essential hypertension, which is the most common type, 90% of cases of high blood pressure are primary or essential hypertension. It doesn't have a specific known cause, usually caused by a variety of both inherited and lifestyle factors. When I say inherited, it means sometimes you inherit the gene from your parents to be hypertensive. And lifestyle is if you're living a life that places you at risk of being high blood pressure. For instance, you're sedentary, you don't move around much, you eat a little bit more than you should, you're a bit overweight, you take a lot of alcohol, and things those are some of the things, or you don't get enough sleep, or you have a very stressful work or job. These are some of the things that people can do that might put them at risk of developing hypertension. So in this case of hypertension, it doesn't have a specific cause, so it doesn't have a permanent cure. And because it doesn't have a cure, one needs to continuously monitor and manage it both with lifestyle changes and with medications. So a lot of people come to the hospital, they're told they have high blood pressure, and they are given medications. They don't realize that those medications are actually indefinite, meaning that when they finish that dose, they need to continue with another dose. So they take the drugs for maybe 1 or 2 months, and then when the medications finish, they stop. And the hypertension, of course, comes back, and sometimes even worse. So with most cases of hypertension, as I said, it's this primary type, it's not curable. So whoever is diagnosed with hypertension needs to be on medications lifelong. So it's lifelong treatment. It's difficult, yes, but it's either that or developing some of the complications of hypertension, which include what we call stroke or partial stroke. Stroke is when one side of the body becomes paralyzed suddenly, and in many cases of stroke, death can occur, and that's where you have people having sudden death. And heart failure is when the blood pressure is so high that it begins to damage the heart muscles, and the heart muscles can no longer function the way they should. Now the heart is what pumps blood and oxygen to the whole body, so if it's not working properly, you have a faulty pump, and it can be very devastating. There may be leg swelling, difficulty in breathing, easy tiredness, and it's really a terrible thing to have. And if your blood pressure is high, it can also cause kidney failure. The high blood pressure can damage the kidneys and stop the kidneys from functioning properly. So high blood pressure can be very, very life-threatening if not properly controlled. However, with medication and lifestyle changes, high blood pressure can be easily controlled, and a person with high blood pressure can live a very normal life.